gears a little bit and talk about another topic because another one of your expertise. One of the things we know is when patients get diagnosed with melanoma, they tend to ask a lot of questions about, about the sun exposure, how many nevi they have, etc. I know you've done a lot of studies on kids and followed a large cohort of kids over years, and you've discovered some stuff is quite interesting. You want to talk about those studies?
Sure. I mean, so in general, this is what we refer to epidemiologically as risk stratification, meaning can we predict who's more likely to get melanoma? And for those who are going to get melanoma, can we predict which of those are going to be serious and spread and potentially kill people? That's really important because, like anything else, if you look hard enough, you're going to find things. But if you're finding things that are not biologically important, you're going to do more harm than good. And the flip side of it is if somebody's truly at significantly increased risk, that's the person for whom it is worthwhile to spend the extra time and effort to be good about sun protection and to get regular checkups. So the things that we were trying to understand, over the decades is, can we predict who's more likely to get melanoma in the first place? And it turns out that, as you've already alluded to, one of the most important factors is genetic. Okay, and that is, are there other people in your family who've had melanoma? That would definitely suggest that there's some genetic predisposition potentially, right? And one of the strongest genetic markers of risk is having lots of moles. And one of the things that we've tried to understand is how much about what your moles look like is genetic versus environmental, the sun exposure you got as a young person. And so the short answer is most of what your moles look like is genetically determined. And so, but sun still plays a modifying factor. So that's number one. So the number of moles you have and how funky your moles look, as I alluded to earlier, is one of the strongest risk factors for melanoma. And especially if you have a lot of moles, funky moles, and a family history of melanoma. But then there are also the families that get melanoma because they're very fair complexioned and they've gotten a ton of sun, right? And so in Australia, it's not that uncommon for people to have a family history of melanoma, even if they don't have lots of funny looking moles, because there are a lot of very fair complexioned people who get a ton of sun exposure. And obviously, the easiest way to know that somebody's already in that category is because they have signs of sun damage. They have lots of freckling and they have lots of sunspots. So in terms of increased risk, it's what your moles look like, what your family history looks like, and what your skin color and sun exposure look like. Regardless of how you're at risk, sun protection is the only way we know of that truly prevents melanoma in the first place. So what we call primary prevention is all about sun protection, and secondary prevention is what we call early detection. The earlier you find it, the more likely you can cure it.
Well, just ask the question a little bit further. So a lot of patients may ask, okay, I have a family history of melanoma, and my dad has lots and lots of moles. But if I practice good photo protection, always wearing sun clothing, sunscreen, what is my probability of getting as many moles, or what's my risk of getting melanoma if I do my best to protect myself?
So interestingly, there are actually risk calculators out there. And one of the best is from the Melanoma Institute of Australia, and you can find it online,
Sure.
where, it tries to do that for you based on, how many moles you have and how much sun exposure, et cetera. The truth is, once you're an adult, there's no reversing your childhood sun exposure. But there's a lot of data that shows no matter when you start, that being good about sun protection reduces your risk of getting melanoma. Doesn't mean you can't get one. And in fact, it's really important to know that you can get melanoma where the sun never shines. And so that while the majority of melanomas are sun related, even if you lived your entire life in a dark room, you can get melanoma. And you can get melanoma in places like your palms, your soles, between your toes, on your private parts, even in your mouth, or even in the back of your eyes. But those are not preventable through sun protection. But over 90% of melanomas are largely preventable with sun protection.
Last category is a question.